If you give birth to a baby, be it a male child or a female child, and this baby is producing milk from their breast, that baby is a winch. Yes. And the milk they produce from their breast is known as a winch milk. So what do? The best thing to do at that moment is to manually express the milk. When I mean manually express the milk, I mean is to press the breast so that all the breast tissues are gone, says an African mom. So if you are in the categories of mothers or you are planning to be a mother, I want you to stop and watch this video to the end so you don't get misinformed by the people out there. Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the nurse with a difference, and I make learning easy and accessible for all my viewers. Today, we are going to be talking about galactorrhea in babies, which simply means babies lactating, babies producing milk. The first question is, are babies supposed to lactate? Are they supposed to produce milk? The answer is no. Babies are not supposed to lactate and babies are not supposed to produce milk. According to accessmedc.com, neonatal galactorrhea occurs in 6% of term newborn, and this is secondary to transplacental transfer of maternal hormones, of maternal estrogen. This simply means that when this baby is in utero, when this baby is in the womb, there is a transfer of some hormones from the mother to the baby. When this baby is still in the womb, not when this baby is outside, when this baby is still in the womb, there is a transfer of a hormone known as estrogen from the mother to the baby. And this hormonal effect, which is the transfer of this estrogen and endogenous prolactin, leads to palpable breast buds in the babies, which usually affects approximately 1/3 of all term babies. Male and female are affected equally. In most cases, this breast milk production usually subsides within the first 2 weeks in the male and also 2 to 6 months in the female. They subside on their own, they go on their own. You don't need to do anything to it. And sometimes these babies that are born with galactorrhea are predisposed, are at risk of going down with mastitis, which is the inflammation of the breast, and also abscess around the breast. These mastitis and abscess might be due to our mothers manually trying to express the milk. Okay, so it is not right. Before I go forward, I want to let you know that any baby born with a breast milk is not a winch. It's just some hormones that are doing their thing in the body and they are going to go away over time. So the milk produced by that baby is not a winch milk. Now let's go to the other causes of galactorrhea in babies. The other cause of galactorrhea, which I would like to share with you, is the medication. What medication are you taking as a pregnant woman? Medications such as opioids are likely going to increase the prolactin level by suppressing the dopamine level. You may want to ask, what are opioids? Opioids are strong painkillers such as morphine, oxycodone, fentanyl, oromorphine. All this belongs to that category of medication that can shoot up the prolactin level by suppressing the dopamine level. Okay, then that takes us to the treatment. How do you then treat galactorrhea? In terms of the treatment of galactorrhea, it is not necessary except there is an infection. Okay, as a mother, you don't need to press the breast bud. You don't need to get a hot water, a towel to press the breast bud to release all the milk. Because while you are trying to do that, you are only putting your child at risk for mastitis and also breast abscess. For those that don't know what mastitis is simply means inflammation of the breast. So at this very tender age, when this baby is born, when this baby is just coming to the earth, treatment is not necessary. But if after months and this baby keep producing milk, or you see this milk production in older children, it is advisable for you to consult your doctor. It is advisable for you to see the doctor as soon as possible, because this can be as a result of some issues with the thyroid gland, because the thyroid gland is a gland that is important when it comes to breast milk production. The thyroid gland regulates your prolactin production. The thyroid gland regulates how high or how low your prolactin is, and high or low prolactin determines on how high your milk production is or how low the milk production is. And it could be pathological elevation of the prolactin level. Okay, I hope you understand what I'm trying to tell you when it comes to galactorrhea in babies. Generally, if you are concerned about the welfare of your baby and you are not settled, rather than expressing the milk out of the baby's breast, it is advisable you speak with the doctor. It's advisable you speak with a midwife. Okay, so if you are a mother and your child is producing breast milk, or you are intending to be a mother and you notice breast milk in your child's breast, I don't want you to be worried. I don't want you to feel that that child is bewitched or that child is a witch. What I would advise you to do, to rule out any doubt or concern from your own perspective, I would advise you to see your doctor. I would advise you to see your midwife for proper guidance on what to do. I hope you got value for this video, and I hope you are properly educated. Please and please don't be stingy. This is an important knowledge that needs to be shared to all your friends, both the male and the female, because we all need to stay informed and avoid misinformation. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.